Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. There are exciting new developments in oncology radiation treatments. Today we're here to talk about TrueBeam technology.
TrueBeam has been a wonderful advance for patient care. It's a very unique treatment strategy where we can image patients' treatment in real time and deliver treatments in a very rapid and nimble manner. It allows us to protect more normal tissue from treatment and give very high sufficient doses to tumor, and leave all the normal tissues intact. It's been a great addition for our group. We're fortunate to have this technology on all three of our treatment campuses. On the university campus in particular, we have the neurology package embedded with TrueBeam, and that allows us to become as tight as 4 millimeters for tumor target orientation, so we can treat very small targets with exquisite precision. The machine that we're fortunate to have at the university campus is the only one available in the region. The table has the ability to accommodate for subtle changes in patient motion and the ability to adapt to treatments on a daily basis as needed. The leaves embedded in the machine dynamically move with motion of the machine, so that we can be far more specific and sculpt radiation dose to the contour and shape of the patient in a much better way than traditional intensity modulation treatments in the past.
What forms of cancer does the TrueBeam technology work best on?
It really works on all cancers because when you think of it, every body cavity has normal tissues that need to be protected. In the head and neck, we have to protect mandible, parotid glands, tooth structure, and other normal tissues that patients, in previous treatment technologies would have higher doses to volumes, which we can do a better job protecting now. We can protect healthy lung parenchyma, protect cardiac subsegments. In the abdomen, we sufficiently exclude small bowel, large bowel from treatment targets. And so it's been a really great addition to our portfolio for patient care. And it's made a big difference for patients really in all disease sites. The way that the technology works, there are thousands of motions of individual leaves hidden in the treatment machine that sculpt X-rays to conform to the shape of the target. We published a paper in 2012 looking at the dose to rib in radiosurgery patients that we were treating for lung nodules within 1 centimeter of the chest wall itself. And we were able to show with the volume modulated arcs in TrueBeam that we gave 70% less dose to rib with these techniques because the shutters, as they moved, dynamically contoured to the shape of the rib. With traditional radiosurgery treatments, you would actually bring dose directly through the rib to treat the tumor target, and so the rib would actually get the same dose as the tumor when the tumor was in close approximation to the rib. There's evidence in the worldwide literature that this would result in a rib fracture in more than 30% of patients. We haven't had that consequence in large part to the technology that we have. So it's actually been a wonderful addition because lung cancer is changing. This is now a molecular disease with peripheral nodules, and more often than not, patients come with more compromised respiratory function, and it's really our job and responsibility to protect that function.
Is a TrueBeam procedure invasive?
What's very nice about this technology in comparison to CyberKnife technologies or other more dated technologies in radiation therapy is that because we have CAT scan technology built into the equipment, we can actually monitor the tumor target without placing a marker, in the patient. So we can actually treat patients without having to have any invasive procedure done. The procedure is actually very elegant because the patient will come and we will build a device that secures their position And then we perform four-dimensional modeling, which essentially monitors internal motion. Once we've established the dynamics of motion, we can then secure the target localization for treatment with CAT scan built into the machine itself. And so we're able to treat people in a matter of minutes, whereas even 10 years ago, this would take most of a treatment day just to do one treatment. So we actually schedule radiosurgery procedures now within the span of a normal treatment time of 15 to 20 minutes. So it's been a remarkable advance for all of us, and it's been a privilege to have and use the technology. When patients are on a treatment table for an extended period of time, there's motion that you can't account for. But now that the treatment is a matter of minutes, and essentially the equivalent of a traditional radiation treatment, this has been a terrific advance for patients for the Worcester community. What the TrueBeam has embedded in it is the fact that the gantry of the machine can move dynamically at the same time as the motion of the leaves. And this allows for a more rapid treatment. And this is really what limits the amount of time the patient has on the treatment table. So with static intensity modulation treatments, we would actually be treating people over a 25 to 30-minute period of time. This is now compressed to 10 minutes, with the use of the volume modulated arcs. And it's made a big difference in every disease area. The breast patients do not have to breath hold. There are a variety of techniques that permit the use of this technology in every disease site. There are clear advantages.